Hello students, today we will discuss about the examination of lump in the neck, and these are the common lumps in the neck. This is goiter, enlarged thyroid gland, and then the second most common lump in the neck is lymph node, and then we can have thyroglossal cyst and many other, but most common are these. Now, the basic examination of every swelling is same. First of all, we have to ask the patient to do proper exposure, as you can see here in the patient, and then you ask the patient that whether he can identify any lump, and if he points out towards any lump, you will examine that first. But if it does not point out, you examine the neck as a whole and you see for any masses, what is their size, their location, and any redness of overlying skin. And two more things which you see on inspection is that you ask the patient to swallow some water and to protrude the tongue to see whether it is thyroglossal cyst or it is thyroid gland. Then comes the palpation. Usually, palpation is done from the front if the swelling is a lymph node or thyroglossal cyst. But if you are suspecting it's thyroid swelling, then you also palpate from the back. And what you have inspected, you confirm it on palpation. That is, you see the size again, then shape, and then after that you see whether the swelling is tender or not, then its consistency, and whether it is firm. Firm is just like your tip of nose, soft is just like your ear lobule, and hard is just like any bony thing. Then its surface, whether it is smooth or it is rough, its edges, whether they are round or sharp, then overlying skin color, or any ulcer or any sinus or fistula which is formed in it. If you're suspecting that it is thyroid gland, because if the swelling it moves on swelling, then you have to also examine the eyes of the patient, because in Graves disease in 30% of cases the eye changes can be there. And these eye changes are lid lag. It means that upper lid is retracted so much so that the sclera above the upper margin of cornea is also visible, which is not normally visible. And then there is lid lag, meaning thereby that when you look down, the lid is lagged behind and the eye globe it moves down. Then you have to see from the side for proptosis. Proptosis means that eyeball is pushed forward. Either you have to see from the side or from the back. Then you have to see whether there is ophthalmoplegia or not. You ask the patient to move eyes to the right side and then to the left side and then up and down. And in case of ophthalmoplegia, depending upon which muscle is weak, the eye will not be able to move in that direction. So this is about thyroid swelling, that if you're suspecting thyroid swelling, then you have to see the eyes as well. While in case of any other swelling, the examination or inspection or palpation from the front is sufficient. So this much about the palpation and inspection of the lump in the neck. I hope this lecture will be helpful for you. Thank you for watching. Give your feedback in the comment section.